Lesson 11. Everyday life therapy, sleep, food, activity, hygiene, responsibilities. Recovery in schizophrenia is not based only on medication, talking to a therapist, or emotional techniques. The deepest and most lasting foundations of stability are created by what you do every single day, the ordinary, simple, repetitive activities that make up your life. Sleep, food, movement, hygiene, small responsibilities, order around you, morning and evening rituals, all these elements build the structure your mind needs to stay balanced. The brain of a person living with schizophrenia is more sensitive to lack of regularity than the brain of a healthy person. Chaos in everyday life opens the door to chaos in the mind. Order in daily life leads to order in thinking. Rest. Sleep is the first and most important pillar. The brain needs a set time for falling asleep and waking up, because a stable biological clock stabilizes the rhythm of thoughts and emotions. Schizophrenia often disrupts sleep. It may be hard to fall asleep, or you wake too early, or you sleep irregularly. This is not your fault, it is the result of neurochemistry. That is why you need to create conditions that help the brain regenerate. Avoiding screens before sleep, regular meal times, a calm last hour of the day, limiting stimuli, darkness and quiet in the bedroom, each of these things has a real therapeutic effect. Good sleep not only reduces anxiety and tension, but also improves concentration and lowers the risk of relapse. There is no healthy mind without healthy sleep. There are evenings when the body is tired but the mind cannot stop. Thoughts circle, memories come back, tension rises, and sleep will not come. In people living with schizophrenia, evening over-arousal is common. It is the effect of stress, accumulated emotions, medication, or simple exhaustion. When the brain is overloaded, it tries to close the day one more time. This is exactly why you must teach it that night is the time to let go of control, not the time to solve problems. First of all, it is worth giving up the habit of lying in bed hoping that sleep will come by itself. When 20 minutes pass and your thoughts are still speeding up, it is best to get up. This is not a failure, it is one of the basic rules of professional insomnia therapy. The brain needs to learn that the bed is a place for sleep, not a battlefield with thoughts. It is enough to go into another room or sit on a chair in dim light and allow the arousal to slowly subside. When sleepiness returns, you go back to bed. A few such cycles can completely repair the link between the place of sleep and falling asleep. When the mind is racing, do not try to calm it by force, that only increases its activity. It helps to direct your attention to something simple and physical. You can listen to the sounds around you, feel the touch of the sheets under your fingers, count a few breaths, or let your attention rest on one calm object. These small anchors pull the mind away from racing thoughts because they move you from the space of thinking into the space of the senses. Overactive thoughts cannot hold on where attention is touching reality. Your body can also help your mind fall asleep. If you feel tension, try clenching your hands for 2 seconds and then relaxing them. You can do the same with your shoulders, jaw, or legs. This very short clench-release impulse works like a calming signal sent deep into the nervous system. The body takes it as a sign that the day is ending. A few minutes of this work with the body can calm psychological chaos more effectively than long meditations or attempts to silence thoughts with logic. Sometimes overactive thoughts keep returning to one topic, as if they wanted to finish something. You do not have to do that now. It helps to keep a small piece of paper by the bed and write one short note, "I'll come back to this tomorrow." The very act of writing frees the mind from the duty of staying on guard. The subconscious stops watching over the issue because it has been secured. This simple gesture is one of the most effective tools when the mind resists sleep with arguments. It is also worth supporting the body with coolness. The bedroom should be slightly cooler than the rest of the home, ideally around 19 degrees. Lower temperature helps the body switch into night mode. The biological signal for sleep is closely linked to the body cooling down. It is a natural evolutionary mechanism worth using. One of the gentlest and most beautiful evening rituals is dimming the lights. Turn off the main light and sit for 10 minutes with a single small lamp. This gesture has symbolic and physiological meaning. Light tells the brain whether it is day or night. When you turn off the lamps, your awareness learns that the time for activity has passed. This preparation for sleep is just as important as lying in bed itself. In darkness, the brain releases melatonin, the sleep hormone. The most important thing is to know that the evening is not the time to solve problems. A way of putting down responsibility for the next day is to write out a plan for tomorrow. Putting it on paper calms the mind and makes it easier to fall asleep. After 8 p.m., do not start difficult conversations, do not analyze the past, do not plan major decisions. Your mind has the right to rest. If a worry, thought, or tension appears, say to yourself, "Tomorrow." This one word has great power. It stops the spiral of thoughts and turns you toward the quiet that is essential for sleep. In the Buddhist tradition, evening is the time of putting the day away. You put aside what you no longer need, release tension, calm the body and mind. You do not fight yourself, you let what is active gradually fade. 3 calm breaths are enough to begin this process. You do not go looking for sleep. You allow sleep to find you. If, despite using the methods described, sleep remains severely disturbed for several nights in a row, it is worth contacting your psychiatrist. Insomnia is a common part of schizophrenia and does not mean that your condition is worsening. It is only a sign that the body needs extra support. Modern medicine has gentle, effective, and well-researched ways of regulating sleep. The doctor will choose a solution that is safe for you, fits your treatment, and is not burdensome. They will also help you set a way of taking sleeping medication so that it is a support, not a burden. You do not have to deal with insomnia alone. That is exactly what specialist care is for. Meals. The second pillar is food. The brain is an organ that uses enormous amounts of energy, and its work depends on what you feed it. Sudden sugar spikes, irregular meals, fast food eaten on impulse, all of this weakens neurochemical balance and intensifies symptoms. Regular, calm eating based on vegetables, protein, healthy fats, whole grains, and proper hydration stabilizes emotions and improves concentration. You do not need any special diet. Predictability and simplicity are enough. It is also worth learning to recognize when hunger is physical and when it is emotional. In schizophrenia, compulsive eating often appears as an attempt to cope with anxiety. The awareness of this mechanism alone already brings relief. Many antipsychotic medications affect the hunger and satiety centers in the brain. This is not your weakness or lack of willpower, it is the effect of acting on dopamine, serotonin, and histamine receptors that regulate appetite. Medications can trigger sudden attacks of hunger, cravings for sweet foods, evening or even nighttime eating. This hunger is often sudden, intense, and unlike normal physical need. That is why it is so important to understand this mechanism and learn to deal with it gently, realistically, and without guilt. The first method is learning to distinguish two types of hunger, physical and pharmacological. Physical hunger builds up gradually and satiety appears after a meal. Pharmacological hunger is sudden, often accompanied by psychological tension, and does not go away even after eating a lot. If you learn to recognize the second type, it will be easier not to treat it as a call to immediate action. Pharmacological hunger is a signal from the brain, not from the body. The second method is preparing safe substitutes. Medications often cause strong cravings for sweet and fatty foods, which leads to rapid weight gain that is later hard to reverse. Yet you can satisfy the need to eat with things that will not harm your health: an apple, porridge, plain yogurt, vegetables, herbal tea, a handful of nuts. It is worth having such things at hand, especially in the evening when cravings are strongest. Preparing healthy snacks in advance is a form of self-care, not self-limitation. During my practice in a Buddhist monastery, we ate only one meal a day, a big breakfast. During the day, hunger grew and by evening became almost unbearable. Drinking hot water with a pinch of powdered chili pepper could ease the feeling of hunger, as could a glass of artificially sweetened fizzy drink. The relief did not last long, but it was enough to fall asleep more comfortably. The third method is regulating meal rhythm. Even if you do not feel hungry in the morning, even if you have an evening eating attack, 3 main meals at set times stabilize energy balance and reduce the number of compulsive eating impulses. When the body knows it receives food at specific hours, the appetite stops jumping and the number of attacks drops. This is not a diet, it is predictability that helps the brain regain balance. The fourth method is introducing a small pause ritual before eating. If you feel a sudden impulse, I must eat something, pause for 2 to 3 minutes. Take a few calm breaths, sit down, drink some water. During this time, the psychological tension that accompanies the craving often drops by half. This is not a technique to suppress hunger, it is a way to separate a real need from a chemical reaction. In practice, it turns out that many hunger attacks last shorter than they seem, if they're given just a little time to subside. The fifth method is not keeping in the house foods that trigger impulses. If you know that under the influence of medication you could eat an entire chocolate bar, do not buy it. If you have a weakness for late evening fast food, do not keep anything in the fridge that imitates its taste. This is not restricting yourself, but a safeguard that protects you at times when your brain is overloaded and you have little influence over impulses. The sixth method is observing your own body. Pharmacotherapy changes metabolism and body temperature, which affects the feeling of hunger. Drinking enough water, light walks after meals, a short nap during the day, all this reduces cravings by stabilizing the nervous system. The combination of water, movement, and calm breathing can be surprisingly effective. From a Buddhist perspective, craving is a form of tension that the mind tries to relieve through the senses. In that case, much of the hunger is not about food at all, it is about anxiety, loneliness, too many stimuli, lack of warmth, or a sense of chaos. If you start to observe what appears in you at the moment of craving, you may discover that it is not food that is needed, but soothing. This awareness allows you to replace what used to be food with breathing, movement, music, or talking to someone close. The most important thing is to remember that you are not guilty of how your body reacts to medication. This is not a weakness of character. It is a neurochemical mechanism that can be worked around with soft methods, not force. Small, regular changes have great power. One tiny modification a day, a healthy snack instead of sweets, a short walk after dinner, a fixed breakfast time, can completely change the rhythm of your hunger and restore your sense of control over your own body. If, despite using these methods, your appetite still gets out of control and eating becomes hard to manage, it is worth discussing this with your psychiatrist. This is not a failure or weakness. Disordered appetite is a common biological reaction to medication. The doctor might suggest small changes in treatment or offer solutions that help you regain balance. Sometimes it is enough to change the time you take the medication, add a mild appetite-regulating preparation, or adjust the dose so that the body stops sending false hunger signals. You do not have to struggle with this alone. Specialist support is a natural part of treatment and helps build a calmer relationship with food. Movement. The third pillar is physical activity, even minimal. Movement acts as a natural stabilizer of the nervous system. It slows thoughts, reduces stress, lifts mood, helps you sleep, and restores a sense of agency. It is not about intense workouts. 20 to 30 minutes of gentle walking a day is enough. In many schizophrenia therapies, a method called behavioral activation is introduced. It involves doing small physical actions at regular intervals. A walk, light stretching, small household tasks, watering plants, all of this creates a rhythm that is like a breath for your mind. The body is the best anchor for awareness. When the body performs calm, repetitive movements, the mind settles naturally. Physical activity is one of the most powerful tools for stabilizing mental health we know. In schizophrenia, movement is not an add-on or luxury, it is part of therapy because it calms the nervous system, regulates neurotransmitters, and improves cognitive functions. Even the simplest activity acts as a natural anti-anxiety, antidepressant, and sleep-supporting medicine. The key is to match activity to age, fitness, and any coexisting illnesses. It is not about intensity or performance, it is about rhythm, repetition, and gentle stimulation of the body. For many people, the best choice is a simple walk. It is safe for every age and almost every health condition. Steady walking calms intrusive thoughts, stabilizes breathing, improves circulation, and restores a sense of contact with reality. Walking is recommended in every handbook on working with psychosis because it does not overload the body and acts as an anchor of mindfulness, placing your feet, feeling the ground, and the body's rhythm naturally organize thoughts. The downside of this activity can be its monotony, which not everyone enjoys, and weather limitations. For older people and those with joint problems, walking may bring pain, but this can be reduced by choosing level pavements, going at a slower pace, and using a cane or walking poles. Another form of movement often recommended in psychiatry is cycling, both on a stationary bike and a regular one. For younger and middle-aged people without serious knee or heart disease, cycling provides pleasure, a sense of freedom and lightness. It strengthens the heart, boosts metabolism, helps control weight, and improves blood flow to the brain, which matters for concentration and memory. The disadvantages can be the higher cost of equipment and the risk of knee strain if the bike is poorly adjusted. People with diabetes, overweight, or high blood pressure benefit greatly from cycling as long as the effort is not too intense. A moderate pace is best. For older people and those with mobility limitations, swimming works very well. Water takes the load off the joints, lets you make wide movements without pain, and evenly engages the whole body. Swimming calms, relaxes, evens out breathing, and soothes muscle tension. It is ideal for people with obesity, joint degeneration, or chronic back pain. The disadvantages are access to a pool and higher costs, and the fact that not everyone feels comfortable in water. But if conditions allow, it is one of the best activities for psychological balance. Yoga and stretching are often recommended in schizophrenia therapy but need to be approached with care. Their advantages include relaxing muscles, calming the breath, and improving flexibility. Gentle yoga can also greatly reduce stress and tension. The problem appears when practice becomes too intense or too meditative. In schizophrenia, introspective techniques can sometimes intensify symptoms. That is why the best option is simple, physical stretching exercises, without visualizations and deep contemplations. For older people or those with spinal injury, some poses may be unsuitable, but basic stretching is safe for almost everyone. For some people, dance is a good choice, spontaneous, free, light. It is an activity that combines movement with a touch of joy, and the rhythm of music makes it easier to focus. Many people with schizophrenia notice an improved mood when they allow themselves a few minutes of free dancing at home. The downside can be quick tiredness or dizziness if medications affect blood pressure, so the intensity should be low. Dance is also not recommended when there are serious balance problems. Older people or those with joint diseases can benefit from simple chair exercises, sitting down and standing up, circling the arms, lifting the legs while seated. These activities improve circulation, strengthen muscles, and prevent joint stiffness, while not overloading the body. Such exercises are recommended in psychiatric rehabilitation for people with limited mobility, Parkinson's, diabetes, or high blood pressure. For many people treated with antipsychotics, so-called extrapyramidal symptoms appear: muscle stiffness, slowed movements, hand tremor, a feeling of heavy body, or motor restlessness. This is the effect of medication on the nervous system, not any fault of the body. This is exactly why movement is one of the most natural and effective ways to ease these symptoms. Gentle physical activity activates muscles, improves blood flow, reduces stiffness, relaxes tightness, and helps restore fluidity of movement. Even a short walk, slow arm circles, or stretching can significantly reduce discomfort and limit side effects. Movement also activates natural neurotransmitters that improve mood and stabilize tension, which makes the body stop reacting to medication with excessive stiffness. That is why every form of gentle, regular exercise becomes not only a workout but also part of therapy for the nervous system and helps you regain a sense of lightness, so important in daily functioning. Physical activity must be adapted to the person, not the other way around. For one person, the best form will be 15 minutes of walking, for another, 2 hours of gardening, for an older person, 10 minutes of arm stretches. Every form of movement has benefits if it is regular, at a calm pace, and without excessive pressure. The most important thing is that activity be done with kindness toward yourself, with the sense that body and mind are cooperating, not competing. It is worth remembering that not every form of movement will suit everyone. Sometimes the body is weakened after long treatment. There are joint pains, spine problems, diabetes, obesity, extrapyramidal symptoms, or simply poor fitness. In such situations, consulting a physiotherapist can be extremely helpful. A specialist can choose exercises not only for your age and health, but for your current abilities and limitations, so that movement is safe, strengthening, and tailored to your individual needs. A physiotherapist can assess your range of motion, muscle function, balance, flexibility, and level of tension, and then suggest sets of exercises that truly bring benefits and do not overload you. Thanks to this, physical activity stops being a source of fear or discomfort and becomes gentle support in recovery, something that builds strength and a sense of safety in your own body. Hygiene. Personal hygiene is not just about taking care of the body, it is a way of tidying your mind by tidying your outer form. When a person is in a poorer mental state, they often neglect self-care, clothes, hair, cleanliness. This is normal and very common. Yet daily face washing, a shower, clean clothes, these are signals sent to the brain: I am a human being, I am here, I am present in my own life. Hygiene is a form of affirming your own worth. Even if you don't have the strength to do everything, do one thing. The smallest gesture has huge importance because every act of order is a counterweight to the chaos of illness. Personal hygiene is one of the most neglected, yet most basic elements of everyday recovery. From the outside it may look like a small chore, but in schizophrenia it requires effort comparable to a psychological task. Disturbed energy, anhedonia, psychomotor slowdown, negative symptoms, depression, anxiety and medication effects all make daily hygiene activities difficult. Many therapies emphasize that taking care of the body means at the same time taking care of the mind. It is a form of putting yourself in order, which strengthens the sense of existence, presence, and control over your own life. For many people it is hard to start morning or evening hygiene because they feel overwhelmed by the very thought of the effort. This is normal. In schizophrenia, behavioral activation works more slowly and motivation does not appear spontaneously. That is why it is so important to break tasks down into very small steps. Instead of thinking I have to take a shower, it is enough to start with "I'll go into the bathroom." Then "I'll wash my face." Then, if there is enough strength, "I'll take a quick shower." This method, described in detail in CBT manuals for schizophrenia, works much better than trying to do everything at once. Every small step is a victory, and your body will tell you whether you have the strength for the next one. Another challenge is not feeling the need for hygiene. Negative symptoms and some medications can disturb your sense of discomfort, so you do not notice that your skin, hair, or clothes need refreshing. For this reason, it is helpful to introduce a fixed ritual, a shower every other day, brushing your teeth morning and evening, changing socks and underwear every day. Not because you feel the need, but because your body works better when it has a clear rhythm. Such rituals create a sense of stability that has a very positive effect on mental health. A separate issue is sensory hypersensitivity. In schizophrenia, touch, temperature, smells, and sounds may be experienced more intensely. Water in the shower may seem too cold or too loud, soap too harsh, and the toothbrush uncomfortable. This is not your fault, these are reactions of the nervous system. In practice, they can be eased by adjusting the environment, using a soft towel, choosing gentle scents, setting a weaker water stream, or using a handheld shower to control the contact with water yourself. Taking care of the body does not have to be unpleasant, it can be made as gentle as possible. It is also worth remembering the so-called hygiene of your surroundings. Therapy manuals point out that an orderly living space has a calming effect on the nervous system. It does not need to be perfect. It is enough that you put one thing back in its place each day. Folding 2 pieces of clothing, washing 1 mug, opening the window for 3 minutes, these small gestures are part of the same psychological hygiene as washing your face. A clean space organizes thoughts, and organized thoughts make it easier to keep the space in order. Some people also tend to neglect hygiene during episodes and later feel ashamed. It is important to know that neglected hygiene in schizophrenia is so common it is part of the diagnostic criteria. It does not indicate laziness, but strain on the nervous system. Shame only weakens you. Instead, it is more helpful to treat hygiene as a small step towards reclaiming yourself. Daily hygiene is like a Buddhist ritual. It is not about appearance, but about restoring harmony in body and mind. A neglected body brings in chaos. A cared-for body creates order. When you wash your face, you are not only removing dirt, symbolically, you are washing away the weight of the day. When you change clothes, you are beginning anew. Hygiene thus becomes a practice of care, not a burden. Not everyone has the strength to take care of hygiene on their own. Sometimes medications cause muscle weakness, dizziness, or slowed movements. At other times, negative symptoms of the illness make even walking to the bathroom feel overwhelming. Sometimes the body is so tired that simply making a few movements becomes difficult. This is not a failure, it is a natural result of schizophrenia and pharmacotherapy. This is exactly why asking for help is not only acceptable, but therapeutic. Help does not have to mean losing independence. It can be support in very small things, handing you fresh clothes, turning on the shower, bringing a towel, reminding you about evening washing, helping wash your hair, or folding clothes together. A caregiver can also help tidy your room if fatigue or symptoms make chaos build up faster than you can manage it. Such support is not doing things for you, it is part of recovery, just as much as handing you your medication or going for a walk together. Many therapeutic programs stress that people living with schizophrenia have the right to support with hygiene just like people with neurological illnesses, after stroke, or with physical disabilities. The body needs help, and that is normal. It is worth agreeing with your caregiver on clear boundaries and rules, what you need, what kind of help you expect, what is comfortable for you and what is not. It is also good to say clearly when you need help and when you want to try doing things on your own. Asking for help with hygiene does not mean weakness, it means maturity. It means that you are taking care of yourself even when your body requires support. This is the definition of care, jointly looking after your health, comfort, and daily life. From a Buddhist perspective, asking for help is not a burden, it is part of community. When someone helps you wash your hair, care for your body, or tidy your space, they build a circle of safety around you. And in such a circle, recovery comes more easily. Taking care of hygiene is not only about washing the body, but also about the ability to observe it. In schizophrenia, especially during intensive pharmacotherapy, small skin problems can appear: chafing, irritation, dryness, redness, allergic reactions, or even a change in body odor. This does not result from neglect, it is often the effect of medication, hormonal changes, or simple physical exhaustion. That is why it is worth calmly looking over your body every few days, the skin under your arms, in the groin area, on the feet, under the breasts, on the neck and back. This is not meant to be control, but a form of care, like checking the weather before leaving the house. If you notice unusual changes, redness, rash, burning, an unpleasant smell, moist chafing, sudden itching or pain, do not try to fight this on your own. Contact a doctor or nurse, because these changes often require simple, quick treatment: an antifungal ointment, a soothing cream, changing detergent, switching to milder soap, or adjusting part of your medication. Responding in time prevents bigger problems and helps the body stay comfortable. This is also part of psychological hygiene. A cared-for body brings peace to the mind, and a sense of safety supports the process of recovery. Responsibilities. The fifth pillar is responsibilities: small, simple, doable tasks. People living with schizophrenia often feel overwhelmed even by the smallest duty. This is the result of overload in the cognitive system and lowered motivation. That is why responsibilities have to be small and concrete. Making the bed, washing a mug, folding one t-shirt, taking out the rubbish. When you complete one such task, your brain learns, "I can." Everyday responsibilities are one of the most important therapeutic tools in schizophrenia. Clinical manuals often call them stabilizing microtasks because they give the day structure, build rhythm, and create a sense of agency. When illness weakens motivation, slows the body, or scatters attention, even the smallest tasks can feel difficult. Yet it is exactly these tiny responsibilities that form the foundation of returning to balance. Thanks to them, the day does not dissolve into chaos, and the mind receives a signal: I am present, I am in my life. It is best to start with small, very simple tasks, such as taking out the rubbish, wiping the table, folding one t-shirt, or watering 2 plants. Each of these actions is like a little stone added to a stable wall. Their advantage is that they can be done in a few minutes, without mental effort and without extended concentration. They bring a quick result. You can immediately see that something has been done, which is particularly important when a person is struggling with limited ability to plan and carry out sequences of actions. IMR and CBTP manuals emphasize that this quick reward in the form of a visible effect is one of the key elements in restoring motivation. Over time, responsibilities can expand into larger tasks: putting on a load of laundry, washing 2 plates, vacuuming 1 part of the room, briefly tidying the desk, sorting rubbish, preparing a simple meal. Each of these tasks teaches the brain organization and sequencing of actions, which are usually difficult for people in remission after psychotic episodes. This is why many therapies use tasks in pieces. Large responsibilities are broken down into several small steps so that they do not overwhelm and can be completed without stress. Responsibilities can also be chosen based on age and coexisting illnesses. Older people can focus on less physically demanding tasks: sweeping with a light broom, folding towels, sorting documents, organizing clothes, watering potted plants, careful washing of hands and face, or wiping shelves with a soft cloth. For people with movement problems, such as joint diseases or extrapyramidal symptoms, tasks done while sitting are better: folding things, cleaning small objects, sorting medicines in a weekly pill organizer, or reviewing shopping lists. In this way, the body is not overloaded, while the sense of activity is preserved. There are also responsibilities that bring particularly strong psychological benefit. Making the bed every morning is one of them. It is a tiny gesture, but it creates a sense of closing the previous day and starting a new one. Many therapists recommend introducing this single ritual as a first step towards organizing everyday life. Another example is preparing a simple meal, even if it is just a sandwich or peeling some fruit. This gives a sense of independence and strength, which is especially important for people who feel dependent on others because of the illness. Of course, responsibilities can also bring difficulties. People with negative symptoms or chronic fatigue may feel they lack strength and motivation. For some, planning may be too burdensome, and even thinking about duties can trigger tension. In such moments, you should not force yourself or punish yourself for not doing things. It is enough to take one very small step: put one item back, drink a glass of water, sit at the desk for 1 minute. In therapy, there is a saying: a micro-task done in 10 seconds has more power than a big plan you cannot carry out. There are also situations in which responsibilities may cause frustration, especially when the body does not cooperate. Older people, those with overweight, diabetes, joint problems, or extrapyramidal symptoms may feel pain, stiffness, or quick exhaustion. In such cases, the day should be organized so that tasks are short, interwoven with rest, and adjusted to how you feel at the time. Support from a caregiver can mean doing a task together, folding clothes together, wiping the table together, sorting things together. Working with someone else is easier because it lowers the feeling of being overwhelmed and gives a greater sense of safety. Responsibilities work like therapy also because they create boundaries of reality. In schizophrenia, the mind can drift into thoughts, fears, delusions, and imaginations. Simple actions, like washing a dish or tidying a desk, pull the mind back into the here and now, into the place where the body is moving and reality has its form and weight. This is a subtle but very important way of grounding awareness. Finally, it is worth adding that responsibilities give a sense of dignity. Every completed gesture, even the smallest, reminds you that you have influence over your life. In schizophrenia, the sense of agency is often shaken by symptoms, medication, and thought chaos. Responsibilities rebuild this sense step by step, day by day. These are not just chores. They are tools for building yourself. If, despite trying to introduce small responsibilities, you still feel they are too difficult, overwhelming, or trigger anxiety or discouragement, it is worth asking a psychologist for help. In schizophrenia, different cognitive functions, planning, divided attention, initiating action, may work differently than in a healthy person, so the right level of tasks should be tailored individually. A psychologist will help assess your current abilities, suggest how to break actions down into the smallest doable steps, and how to build a daily rhythm without overloading yourself. This is not an admission of weakness, but part of professional therapy. Specialist support allows you to match responsibilities to your own pace, so that doing them becomes strengthening rather than exhausting. In this way, even the smallest tasks can become steps towards regaining stability and a sense of control. Summary: Buddhism has taught for centuries that outer order stabilizes inner order. Monks start the day by cleaning their cell because they know the mind works best in a clear space. Taking care of the cleanliness of your surroundings is not a duty, but a mindfulness practice. This is my world. This is my refuge. This is where I build peace. You can bring this way of thinking into your own life and treat everyday tasks not as a burden, but as an exercise in presence. Washing dishes can be a practice of calm. Folding clothes can be a practice of focus. Tidying your space can be a practice of grounding yourself in reality. Everyday life therapy does not mean doing everything perfectly. It means doing something, small steps that build your day. Simple things work best: a fixed sleep time, regular meals, some movement, a moment for hygiene, 2 small tasks, a short rest. It is exactly this repetition that creates stabilizing frames. Illness takes away predictability, and you can bring it back day by day.